Take advantage of any time you have an opportunity to stabilize your hand on the patient arm when attempting an IV. This allows more precise control of the needle insertion. It also helps reduce the chance of the patient pulling their arm away during the needle insertion. Notice how you have less control when your needle is in the air, so you're not as precise. By putting your hand and resting it, you have more precision of the needle direction. In your leg, that's going to give you less movement of your arm. So you're bracing here, and you're going to kind of rest your fingers here. Your pinky finger gives you a little bit of an anchoring point while you pull that skin tight, and then you have good control of that needle. I say it's harder to control your needle when you're trying to start an IV without any anchoring points, because all your movement's coming from your shoulder. So the less movement you have, the more precision you have with that needle insertion. And you'll use your fingers right here kind of as a little bit of an anchoring point to help give precision with that needle insertion. Always remember, try to do your IV starts in the upper arm. You know, the ACs a lot of times where we'll start looking for veins. You find those veins that'll work down into the forearm. Those are always best for your patients because they last longer. Sometimes in the bend of the arm, they get kinked off, but you always have options down here in the wrist. You know, preferably you want the forearm. You know, your second choices are in the hand and working your way distal. Of course, the bigger the veins, the better those IVs are going to last.